Hi guys, I'm Dr. Doug Whitfield and I wanted to talk today about periodontal disease and what it really is. It's a tough topic sometimes to talk about because people don't always feel their gums are infected or diseased. Okay, but periodontal disease or gum disease or inflammation of the gums, it's all the same thing. Okay, I have created a little worksheet for my staff and for my patients in my practice, and I practice dentistry in the Seattle metro area. And I call it the Periodontal Therapy Bible, okay? First off, I want to let everybody know that if you're 50 years or older, then over 75% of that population has periodontal disease. So if you're frankly looking at any of my videos and you're thinking about this, there's 3/4 of a chance you have periodontal disease, okay? Really, you're a very high percentage, okay? So let's talk about what periodontal disease is, okay? Periodontal disease is an infection by bacteria of your gums around teeth, okay? Periodontium is a term used to describe circumferentially around the tooth. And around that tooth are little ligaments, little fingers, ligaments that connect the bone socket to the tooth. And when bacteria, pathogenic bacteria, are down along that tooth, around those root surfaces, that causes inflammation. And so what is inflammation? It's your body's reaction to something foreign, bacteria, okay? And then all of a sudden your body's sending neutrophils, oh, fancy word, and antibodies sometimes, and all macrophages, and all these different systems of the innate immunity, primarily, to go in there and kill and neutralize the bacteria. The problem is this system is like throwing hand grenades sometimes to kill the bacteria, your own body, okay? And that breaks down these little fingers or ligaments. And as these things break down, the bacteria get into the bone around the socket. And then we get bone loss around the tooth, okay? So bone loss, bleeding, these are bad things, and there are what constitute periodontal disease. Now I'm shifting around a little bit here, moving along in this shot because I have a picture of a classic example of a couple of teeth that have a lot of bone loss. Hard for the patient to keep clean themselves. Pathogenic bacteria are all over the place. And the body has tried to defend itself by coming in with neutrophils and so forth, but that immune response has also caused a tremendous amount of bone loss. So let me grab this photo and show you what I'm talking about, okay? So if you look at these teeth, they're not healthy, okay? No, not at all. And what I can see, because I'm trained in this obviously, is chunks of calculus, rough, irregular tooth surfaces, root surfaces, and I see teeth that are barely holding on by basically their fingernails, okay? And so things like that is tremendous bone loss. Bone should be up here, it's all the way down here. Bone should be up here, it's all the way down there, okay? And irregular surfaces, okay? Somewhat moth-eaten, as if a moth is eating the bone away, okay? These are not healthy things, okay? That is periodontal disease. So how do we treat periodontal disease? Well, every dental practice has some basic concepts, such as using ultrasonic or scaling hand instruments to clean along the root surfaces and get all the calculus and all the gross amount, large deposits of bacteria off, okay? But let's get modern. This is the 21st century, and frankly, I'm tired of us using crude methods. We have an infection of bacteria, and so what we are going to do to fix this, and some of the more advanced practices are going to do, is they're going to use the piezo or more sophisticated scaling instruments to clean off the deposits. They are going to use skilled hand instruments, okay? But they're also going to use things like an air polisher, which actually uses air and small little glycolic beads, sort of like a sandblaster, to clean off the surfaces. And then finally, the most sophisticated practices are going to use a laser to disinfect the tissue, because you can get the tooth surface clean, but if the bacteria have gotten into the gum tissue around the socket, you really need to use a laser to completely decontaminate that gum tissue. And then you finish it off. Hopefully you've done some bacterial testing so you know what kind of pathogens are there. And then if a systemic, a pop it in the mouth antibiotic is needed, you can do it. So think of periodontal disease as a legit disease that you don't want in your body. And you gotta think of it as, when it's being treated, that it is a whole body, whole mouth disinfection process. Can't just treat one segment of your mouth and not expect the bacteria to travel to the other. Anyway, it's a pretty big topic. I worked today and I'm thinking, you know what? Let's talk about this. Let's at least get something out there into the interwebs so people can start thinking about this. And you know, we'll touch on this topic again and again. There's so many really cool treatments going on out there. And I encourage you to reach out to us and our office if you're interested in finding out more about some of the new modern techniques. Thanks, guys.